Very good evening to all. I'm Dr. Rutra Mohan from the IAP Digital team. We are live on IAP India YouTube channel. The webinar for today is Physiotherapeutic and Homeopathic Approach Towards PCOD. This webinar is being organized by East Delhi District team. I request all to subscribe to IAP India YouTube channel. I'll be sharing the link on the chat. By subscribing, you can get regular updates during our live webinars. Now I request Dr. Vidhu to please take over.
Good evening, everyone. I, Dr. Vidhu, on behalf of East Delhi IAPWC, welcome you all. Women are the epitome of courage, hope, and life. The first ever National Women's Day was established in 1909 and has continued to spread to several different countries around the world. We are celebrating 8th March as International Women's Day every year. So on the occasion of the Women's Day, we have chosen this sensitive topic of PCOD to be discussed here, which is getting so common these days among women. So today we have Dr. Renu Sharma, head of the department, GTB Hospital, and Dr. Priyanka, who is a consultant homeopath. Welcome Dr. Renu and Dr. Priyanka on the online platform of Indian Association of Physiotherapists Prevalence. So let us start the topic straight away with some brief knowledge about PCOD. Am I audible to everyone?
Yes, Dr. Vidhu.
Yes.
So PCOD. As everybody knows, PCOD is polycystic ovarian disorder. So let us start with what is PCOD. It is the most common hormonal disorder found in women who are in the reproductive age. And it is really hitting 1 in every 5 women. It is the most common cause of infertility. Despite this, many women can still conceive on their own or with the help of fertility treatment. Right. So as you people can see, this is the normal ovary and this is the polycystic ovary. So let us know what is menstrual cycle. So menstrual cycle is basically takes 28 days to 1 month to get it complete, right? So 12 से 17 दिन के अंदर ovulation होता है, and with a few hormone balance की वजह से ovulation takes place and उसके बाद bleeding start होती है. अगर fertilization नहीं होता, then starts bleeding and it goes off, right? But polycystic ovaries में what happen कि जब ovulation होता है, so ovulation के time पे एक LH hormone होता है, which is a luteinizing hormone, which is in the increase हो जाता है. Luteinizing hormone increase हो जाता है, जिसकी वजह से हमारे जो follicles है वो completely ovulation नहीं कर पाते, and that is the reason कि ये cyst form में convert होना start हो जाता है, right? और अगर ये जब cyst form में convert होना start हो जाता है तो ये कुछ इस तरीके से दिखता है, जिसमें कि ovulation होता नहीं है और कुछ ना कुछ complications create करता है body के अंदर. Let us come to the next slide. What are the basic causes for the PCOD? So PCOD is basically, it is a genetic, or it could be environmental, due to the environmental factors, high stress level, insulin resistance, or maybe due to the junk food or irregular eating habits, which is very common these days in young girls or ladies. Late night schedules, obesity, which could be mostly pre-pubertal होती है तो अगर, early onset of menarche, progesterone or estrogen imbalance. So these are the few causes which can cause PCOD. So these are the hormones which release during the ovulation. So LH hormone is luteinizing hormone, right? So luteinizing hormone अगर increase हो जाता है, follicle stimulating hormone कम हो जाता है because of maybe due to many factors. कुछ environmental factors होते हैं, कुछ chemicals होते हैं which disrupt your ovulation process, और कुछ lifestyle आपका इस तरीके से रहता है. Lifestyle में भी आपका अगर obesity है तो again it will cause polycystic ovary, और अगर पॉलिसिस्टिक ओवरी है तो दैट इन टर्न कैन कॉज ओबेसिटी. ओबेसिटी इसमें मोस्टली एब्डोमिनल फैट होता है, एब्डोमेन पे ज्यादा ओबेसिटी होती है. And again is the insulin resistance. Insulin resistance can again encourage the polycystic ovary. Polycystic ovary में ovaries enlarge हो जाती हैं और cyst बन जाती है, एक माला की तरह वो दिखने लगता है अगर हम उसको सोनोग्राफी या आपके अल्ट्रासाउंड में देखते हैं. Next is the common signs and symptoms of the PCOD problem. What are the common signs and symptoms, right? Some females start seeing symptoms around the time of the first period itself. And some women only discover when they gain lot of weight or getting pregnant, right? So irregular menstruation, which is also known as oligomenorrhea. Irregular menstruation हम किसको कहते हैं? जो साल में 9 cycles, minimum जैसे साल में 9 cycles आती है. अगर हर साल में 9 cycles menstrual periods per year आ रही है तो that will be known as irregular menstruation. So we are skipping few of the cycles, right? Skipped or absence of menstruation. Absence of menstruation यानी कि amenorrhea किसे कहेंगे कि अगर menstruation period for at least 6 months तक आपको menstruations नहीं होता है, right? Excessive hair growth mostly on the face, body, including on back, belly and chest. Acne, face, chest और upper back पे ज्यादा रहेगा. Weight gain, especially abdominal fat और deposition रहेगा. Hair loss, hair on the scalp, right? And skin darkening. Most of the regions which are suffering from the skin darkening are the neck or the groin or breast region, right? So these are the few irregular prolonged periods, fluid filled sac and cyst, growth of the extra unwanted hair loss. तो इस तरीके के ये कुछ सिम्टम्स होते हैं जो दिखते रहते हैं. Now come to the associated comorbidities. So what are the comorbidities which we are suffering from, like PCOD patient is suffering from? So one is the obesity. Obesity is maybe due to the insulin resistance की वजह से obesity is the most common thing जिसको, और second is the आपका depression is the most common, and cardiovascular disease. cardiovascular disease में आपका heart related disease आ जाती है, right? ये सारी जो प्रॉब्लम्स आ रही है ये एज बाय एज चेंज होती रहती है. सो एट दी जब हम ओल्डर एज में पहुंचते हैं तो एंडोमेट्रियल कैंसर के चांसेस बढ़ जाते हैं. Yeah, so this is my last slide. Now I think I will hand over the mic to Dr. Renu Sharma. Dr. Renu Sharma is the head of the physiotherapy department, GTB Hospital and UCMS. Dr. Renu Sharma, she has an experience of more than 30 years in the field of physiotherapy. Dr. Renu, she has been working for women health since many years, and she is a gold medalist in naturopathy and yoga. So I hand over the mic to Dr. Renu. Dr. Renu, please take over the forum. Ma'am?
Yeah. Thanks, Dr. Vidhu. Can I have the slides, please? Thanks, Dr. Vidhu, for such a generous introduction. Hello, friends. Now today, it's a very nice topic which has been chosen, and I thank the organizing committee, Team IAP Women's Cell, for arranging this public awareness webinar of this much discussed topic, that is PCOD, as beautifully explained by Dr. Vidhu. Am I audible? Am I audible, Dr. Vidhu?
Yes, ma'am, you are audible. You are very much audible.
Okay, fine. So, yeah. So, she has explained to you the various clinical features of this problem, and how it is caused. And it is basically a multifaceted disorder, wherein you will see so many symptoms and one symptom leading to the other, the vicious circle of cause and effect. Can I have the second slide, please? Yeah, next one. Next slide, please. Yeah. Now, talking about the prevalence, the previous one, please. Previous slide. Yeah. Talking about the prevalence, like the age group, as she has said, that it is between 18 to 44 years. And if we see the prevalence in India, you can see that it is in more common in the urban areas. Common in the urban females. That is giving a pointer towards their sedentary. That is the sedentary lifestyle. So let's keep it for later how we are going to tackle this. Now, next slide. Next slide, please. Yeah, this shows the vicious circle of the cause and the effects of this problem. Next slide, please. Yeah, the clinical features, as she has told you, which include the dermal symptoms. Then there is the systemic disorders like high levels of insulin, then leading to stress, depression. Next slide, please. Next slide with. Then next, this is a visual for showing you the hirsute face, then the loss, hair loss, then that is hyperpigmentation, which is commonly seen in these patients around the neck. This is very typical, or in the groin area. Next slide. Yeah, that is the acne and oily skin which you see. And then the hair loss. Next slide. And this is a visual of the appearance of a polycystic ovary on the right side. The typical bead necklace kind of a view. Now, we have seen all this. Now we know that there are a lot of effects, but as a physiotherapist, it is important for us to know that even the pelvic floor would be affected by this problem. Next slide. Yeah. In the pelvic floor, generally, as a physiotherapist, we will see things like hypertonic pelvic floor. Then, and that is the patient may find it difficult to urinate or defecate. The floor is too tight. There will be pelvic pain. Then urinary incontinence will be there. That is, supposing the patient may leak while laughing or lifting a weight, or urgency symptoms. That is, urgently wanting to go and urinate, or repeated urinations. Then, and that is the frequency of urination. Then painful sexual intercourse, and pain with bowel movements is also seen. Next slide. Yeah, now we have seen the clinical features, what all we will see when you see a patient, what all you will see, and then other things which physiotherapists will see. Now, what to do with so many signs and symptoms and the vicious cycle going on, and the cause is not clear. So what do? We just manage. There is no cure to this problem. We can only manage this. So now the management of PCOS is, again, so many disciplines are involved in this. The first would be the medical approach, which would vary as per the faith of the patient. आपको जहाँ faith है, आप उनके पास जाके इसका treatment ले सकते हैं. Allopathy is there, then homeopathy is there, Ayurveda and naturopathy are there. Then coming to the next management, which is along with the medical management. The medical management will not be total if you do not include the lifestyle changes. So here comes in the role of physiotherapy and yoga, then nutrition and dietetics, then the psychological aspect of this problem, which is very much there, and it is important to tackle this part also. And then coming to the surgical management, which some patients may need. Now this may in surgical is just, you know, say CO2 lasers which are used for you know vaporization of the cysts, if the medical and the lifestyle approaches do not work or have failed or need to be assisted by this procedure. Next slide, Vidhu. Next slide, please. Dr. Vidhu. Next slide, please. Dr. Vidhu, can you hear me? You need to change the slide. Dr. Vidhu, yeah, please change the slide.
Sorry, ma'am, got disconnected in between. I'm getting the slides again. Is it fine now? Is it visible? Is it visible, ma'am? Ma'am, is it visible now?
No, I'm unable to see the slides.
Now?
Yeah, but we have to go to the previous, the role of physiotherapy wala, that slide I want.
Right.
Yeah. Okay. So now what does therapy do in this particular problem? Firstly, what happens if we do physiotherapy or if we do yoga? It helps reduce the insulin resistance, then improve BMR, that is your basal metabolic rate will be taken care of. Then it increases serotonin, which is the happy hormone, that it helps in reduction of stress, anxiety and depression. Then it helps to achieve a fit body, that is muscle gain and fat loss, and hence this way you manage obesity. Then it improves the hormonal levels, whatever disbalance is there, that is gradually over a period of time optimized, and it improves the blood circulation or the blood supply to most of the body or wherever it is compromised. Now, as a physiotherapist, we do not give medicines and we do not do surgery. So we have certain tools in our hands, like we have the joints, the muscles, the fascia, and the ligaments are there. Then the respiratory system we can approach, and through these we can approach the other systems of the body. So we work on basically these things by giving exercises or yoga and pranayama and breathing exercises. Next slide, please. Next slide. Yeah. Now, whenever you will be, as a patient, if you go to a physiotherapy department, when your doctor refers you to a physiotherapy department, the physiotherapist will be, she will be doing some basic assessment, so that she has a baseline from where you started and what kind of a treatment protocol is to be made for you, or exercise protocol. Because Each patient is an individual and your capacities are unique to you. So this assessment helps her to design a exercise protocol just for that particular patient or just you. So she would take a family history, which is very important, whether anybody in your family has had this problem or not. Then she will take, what kind of job you're in, your basic demographic data, that is your weight, height, age, all these things. Then she will take a menstrual history, that at that is what age you are having your periods, whether they are regular or irregular, whether there is any pain while you are having your periods, the flow is heavy or not, or is it less. All these things she will be noting down as a baseline or on day one. Next slide, please. Yeah. Then she will be asking you certain questions regarding your bladder function. That is, what is the frequency of your of micturition? That is, how frequently you are going for the urination. The urge for micturition. Then whether you have any stress incontinence, as I explained earlier. Then your sexual health. Do you experience an orgasm? Is it painful? Or any other thing which you would like to report. Next slide. Yeah, then pelvic floor examination would be a part of the assessment if it is required. So there she will be assessing your muscle strength and various other parameters, not just, and then if there are any trigger points, then what is your, for weight control or weight loss, as it is generally stressed, she will assess your body mass index, then weight hip ratio, then body fat percentage, skin fold thickness, and body morphology. So all these are noted down on day one, along with your medical parameters, whatever lab tests you are having. If, and over a period of time, if there are any changes, would be basically a morale booster both for your treating therapist as well as for you. Next slide. Yeah. So now coming to the exercise protocol designing. Now, when the physiotherapist starts, so the first thing I would like to say to all therapists is that we should not, at the outset itself, if the main problem in these people seems to be obesity, which causes a major stress, and of course poor body image, then certain other problems like skin problems which are visible to the world, the if the lady is hirsute, or there are other issues, balding and things like that. So these are causing a lot of stress. Then infertility, in case if the lady is married, there will be a lot of family pressure. So all these things, are causing stress, and we further give them a target. See, you are so much kilos now, and in that much time we want to reduce so much. So at the start, I would say that we do not give them a weight loss protocol. We Please go to the previous slide only. I have not yet finished. Dr. Vidu, yeah. Step 1. Exercise protocol, step 1. The previous slide. Yeah. So we would give them a inch loss program, rather, I would say, that they should have a more fitter and toned body rather than a weight loss issue. So we start with a warm-up protocol, going on to some easy yogasanas and pranayam, gentle core strengthening exercises, and mild to moderate cardio, as the person can do some brisk walking, cycling, swimming, etc., which they would be able to manage according to the patient. The protocols which are given, they say that, research has shown that about 90 minutes of exercise of moderate intensity per week gives you fairly good results, and in about, say, 6 months you lose about 5 to 7% of the weight. So we need not start with that, but we can say start with a easier protocol, say you know 20 minutes daily or on alternate days, and then gradually increase the time and the intensity. Next slide. Then the second step in this exercise protocol, after say 2 weeks or 3 weeks of this, we can go on to include some bit of the step one, which I showed earlier, and then we can add things like Surya Namaskar, which are little more vigorous things. Then, or if the patient cannot do the proper Surya Namaskar, then she can do the chair Surya Namaskar, which she can do in while sitting in a chair. Then gradually increase the intensity of the core strengthening, the resistance training, and aerobics as you may feel fit. And the time of the exercise can be increased. Next slide. Now, as per my experience with these patients, because you know, in general, whatever this condition is very common, as they say, 1 out of every 10 females would be having PCOD or PCOS. So all of them do not reach the physiotherapy department. This has to be gradually ingrained, though the gynecologists now are very aware and they do send these patients to us, but some of them will come and they may just take the first or the first 2 3 weeks of physiotherapy protocol, and then they may not, because they will not see results so fast. So they have to be convinced, that it is going to take time and they have to continue. We can put them on a home plan. If they do not want to come to the department, they can carry on at home and we can review them, say, every 15 days or monthly basis. That is very important. They have to be told. Secondly, there are a lot, I mean, a physiotherapist has a lot of things at their, lot of tools at their disposal, as you can see on the slide. There is yoga and pranayam, which we have, and we have the physiotherapy protocols, say aquatic therapy, cardio, aerobics, then flexibility exercises, resisted exercises, high intensity interval training. That is, for a small time, you give a high intensity of exercise and then low intensity exercise for another short duration and alternating them. I mean, this is, of course, a very vigorous mode of exercise, which can be taken as per the patient's fitness. And then Pilates is there, which is, again, a system in itself. So all these, it depends on the therapist who is treating you, as well as on the patient's, condition, what is fit for him. So we can choose, or we can take small bits from different protocols. I prefer to include yoga and pranayam in this, because yoga, firstly, it's a very gentle kind of a thing, and yoga does not just include some asanas. Yoga is a full, it is ashtanga yoga, so you can take at least the important things in this, and it helps in management of stress and anxiety especially. And then in case of diabetes, those patients who are having diabetes, high blood pressure, there are various asanas which practiced over a long time, they can keep the patient's condition at a very optimum level. And a good lifestyle can be achieved with a pranayam, especially if especially the nadi shodhan, that is the anulom vilom, which we commonly know. That is a very good pranayam, and it works well because it, I mean, as we know, it balances between the negative and the positive, and so it overall balances the nadis, and that helps in almost everything. You see, all the systems are brought to an optimum level of functioning, as per the patient patient's requirement. Can you put the next slide? Yeah. These are a few asanas as I'm saying. This is the Ardha Matsyendra Asana or the Matsyendra Asana. This can be done, for say, it is very good for diabetes, yeah, and digestive system also. Plus, it increases the circulation and does some pressure mechanics to the pancreas, and also the digestive system, the reproductive system, and other and the metabolic system is helped when you do this asana over a long period of time. Next slide. These are, then this is the Pawan Muktasan, which you know. These patients generally suffer from a lot of bloating and flatulence. So whichever asana they can do out of these, that can be recommended. But please remember that the patient need not choose these asanas themselves. It is better to consult a therapist for this. Next slide. Then these are the Gomukasana, then Vajrasana. All these are helping, in various systems. Say this Vajrasana, it is done after 5 minutes of your after you have taken your food. So this helps in a better digestion and avoidance of flatulence and bloating. Next slide. Same Supta Pavan Muktasan. If the patient can do this, fine, you can go. Then Dhanurasana. This is again good for the spine. Along with that, it is good for the basically the reproductive area, that is the pelvic area, and any adhesions or mobilization of the internal organ in that area. It is really good for that. Next slide. Same way Chakrasana, again useful in mobilization of the internal organs as well as for the skeletal system that we all know. Then Bhujangasana. Next slide. So these are just a few asanas which are generally recommended. Next slide. Yeah. Shavasana is very good for relaxation. We all know, yeah, along with some kind of chanting which you want to do. Next slide. Yeah. So yogasanas, as you have seen, then this is basically a protocol. Some research was done in 2017, and this is the protocol which they followed. This is an aerobic training protocol, and as you can see, there is a rest period. The warm-up period is for 5 to 10 minutes, and the frequency is 5 days per week for 12 to 24 weeks, and it is done basically at a fatigue-free level. That is, once you have done this exercise for the day, that is 30 to 45 minutes, and then you should be tired of fatigue more than that time, then it means you have done more. So that the exercise protocol has to be reduced. I mean, the intensity has to be reduced. And in the end, you do a cool down for 5 to 10 minutes, including stretching exercises. So these are the few exercise protocols which are recommended. Next slide. Next slide, please. Yeah. Then the resistance exercise training. Now here you would be doing exercise against resistance. So you can do them with the help of dumbbells, therapeuts, then weighted pulley machines. And this is a little heavier exercise, but and it is basically it is given at a little later stage, and it depends on the again. Next slide, Dr. Vidhu. Yeah. Then these are a few asanas which have been recommended by people, various studies for PCOS, like the butterfly pose, which we all know. You see it in the Swami Ramdev's sessions. It is very popular. Then the Bhujangasana, which I showed you, Naukasana, and Dhanurasana, asana for circulation and mobilization in the pelvic area. And the Padmasana again for relaxation and Savasana. So now the customized approach, as I've told you, all these are various packages. Some of the researches are there and they have recommended the protocols which I've just shown you. Now they are, to my knowledge, in my whole career as a when I treated these patients, what I saw was that it is very difficult to attribute the results just to say the medical treatment or the physiotherapy treatment, or the yoga has helped this. No, we cannot say. It is a team approach, a combined approach. Just the way the disease is multifaceted, the approach is also multifaceted, and the credit can be given to all the things. So all the things have to work together. तो आपको सभी चीजें करना जरूरी है एज ए पेशेंट. ये चीज आप याद रखें कि ये नहीं हो सकता कि मेडिकल साइड पे बस हम दवा ले रहे हैं एंड दैट्स इट. नो, all these things have to be done. The lifestyle has to change and accepted and continued. It is not just for the younger females or somebody who is presently suffering from infertility. Then she conceived, she had a baby, and that's about it. She's cured. No. She's not. She's a patient for life. She has all which the patient is doing today may need to be changed in due course of time, in due course of her reproductive history, that is right up till menopause. All this will continue. And after, I mean, if you do it that long, then you will continue till later life also. And so the role of the medical approach, the physiotherapist, and if surgery is required, then that, and various other disciplines, or they will be intermittently, the patient will be consulting these people most of the time. But definitely that intervention becomes less. Now the $1,000,000 question, which most people, most of the patients especially and their relatives would ask, is the prevention. कि क्या ऐसा नहीं हो सकता कि हम पहले ही इसको पकड़ लें और ये ना हो. तो definitely we can slow down the process. We can stop certain things from going to their very worst. So the first thing and first and foremost thing, जो कि आपके, क्योंकि ये अवेयरनेस प्रोग्राम है, तो इसमें आपको ये जानना, जैसे आपने सिम्टम्स यू हैव सीन कि क्या क्या होते हैं, क्या क्या क्लिनिकल फीचर्स होते हैं, क्या क्या होता है ऐसे पेशेंट्स में, जो आपको जनरली देखने को मिलेगा. तो उसमें सबसे इम्पोर्टेंट है आपकी मदर को या दादी को कोई प्रॉब्लम रही कंसीव करने में या कोई और दिक्कतें उनको होती थी. यू हैव अ डॉटर and you are having a family history on your mother-in-law's side of PCOD, and or in the earlier times they would not even diagnose this problem. It would go unnoticed. They will just tell you as an anecdote, हाँ उनको प्रॉब्लम होती थी और फिर बहुत इलाज कराया, फिर ऐसे हुआ ऐसे हुआ. So you have to take note of that the moment you have a girl child. Number one, it is very important. Then secondly, you come the moment the girl has a menarche, abnormality, then you visit your gynecologist and maybe whatever history she wants to take. If everything is fine, your child is normal, let it be. But आप lifestyle के ऊपर शुरू से ध्यान दें. Let the child not gain weight. A normal, healthy diet, I would say, is the best diet. Don't go for any specific protocols or fads. So many things are going on. No, I think best home food to whichever area you belong. Whatever food is native to that place, you just feed your child that, but they should not gain weight. वो उसका आप थोड़ा ध्यान रखें. और एक्सरसाइज और योगा अगर शुरू से इनकलकेट कर दें आप बच्चों में, है ना, either in school or at home, make it a family affair that you do yoga and exercise every day, so the child is ingrained into that culture, so she will not gain weight. She will have very then next thing which you have to see is a record of her menstrual cycles. These days, of course, the people living in the city and who are tech savvy, there are so many apps where the child herself can maintain a record of the cycle and what kind of bleeding she had for how many days, any premenstrual tension or whatever, whether it was there or not, all that can be recorded, and you just keep a record, and the mother should check intermittently whether everything is okay or not. And if you see any discrepancies in the menstrual cycles, then the gynecologist consult. And then the healthy lifestyle, as I told you, and awareness, spread the awareness. आपको पता है तो आप 4 और mothers को बताइए, 4 और लोगों को बताइए. और या 4 और ladies को बताइए. मान लो किसी ने, it turns out to be PCOD, then relevant things should be done. And yes, it is manageable. As I said, so many people, as Dr. Vidhu had said, they have conceived, they're living a normal life, but they are a patient of PCOS all their life, and so this treatment continues the whole life. The management continues the whole life. With that message, I would like to hand over to Dr. Vidhu. Are you there?
Thank you so much, Dr. Renu, for acknowledging us on this topic today and focusing upon what all exercises and yoga and asana we can practice in PCOD, and especially focusing and emphasizing that all these exercises should be done after the consultation with a therapist. Thank you so much once again, Dr. Renu ma'am. Now moving ahead today to discuss homeopathic approaches towards PCOD, we have with us gold medalist consultant homeopath of Homeo Life, Dr. Priyanka, with us. Even being well versed in her knowledge, she wanted to learn and become aware of allopathic approach and effect of those medicine on the body in regular setup and also in the emergency services. For this, she had done medical emergency services course as well. Her way of treatment is very much holistic, understanding patient completely and beyond just the physical suffering or symptoms patient is suffering from. So I request Dr. Priyanka to share her valuable knowledge on the today's topic. Dr. Priyanka.
Thank you so much. Hello and good evening, everyone. And first of all, I'd like to thank Dr. Vidhu and the panelists for inviting me to talk. And am I audible? Is my voice clear?
Yes, Dr. Priyanka.
Okay, because I saw one message. So Okay, so thank you so much. Thank you. And as Dr. Renu and Dr. Vidhu already explained us about PCOD, like the reasons of PCOD, the symptoms of PCOD, why it happens, how we should be changing our lifestyles, diet, and what all things we should incorporate and help our body to fight against this PCOD problem. There was a very important line Dr. Renu mentioned, which I really liked, and I always tell it to everybody, all of my patients, that you should not do on your own anything on your own. You need to take advices, whatever it is, exercises or diet. Doctors should be asking and then following that particular regimen. So that is very crucial, because I'll give an example that in PCOD, there's one condition called inflammatory condition of PCOD, where the testosterone or androgen levels are so high. So it is not at all required to do excessive exercises, weight training, or excessive where your body has to suffer a lot of strain or workout, and that produces more and more androgens, which will eventually harm your health. So this is a short example where you need to follow your doctor, and please don't apply your own knowledge or online knowledge. So I want to share my screen. So right now I'll go into the topic straight away. So PCOD, managing it with homeopathic medicines. So whenever patients are coming to us, they're usually in the condition where they have taken a lot of medications already. They have taken all the hormonal pills. They have done the enough knowledge, online studies. They are following a poor lifestyle. यहाँ पे पूर लाइफस्टाइल का मतलब है आपकी डाइट पे आपका ध्यान नहीं है, आपकी नींद पे आपका ध्यान नहीं है, आपकी वर्कआउट्स पे आपका ध्यान नहीं है, आपकी वाटर इनटेक पे आपका ध्यान नहीं है, एंड ऑल्सो योर इमोशनल वेलबींग. सो जब आप इतने ज्यादा स्ट्रेस पे होते हो, आप छोटी छोटी चीजों पे स्ट्रेस लेते हो, वो अफेक्ट करता है आपकी हार्मोनल सिस्टम पे. जो भी बॉडी फॉलो करती है अपना रूटीन, इट्स लाइक अ मशीन. योर बॉडी इज लाइक अ मशीन. अगर आप कोई भी लाइट लगाते हो रूम पे, तो वो लाइट करंट फ्लो होके आपको रोशनी देता है. द एग्जैक्ट सेम मेथोडोलॉजी इज फॉलोड बाय योर बॉडी, बट द ओनली थिंग, यू नीड टू मेक अ हेल्दी प्लेस. यू नीड टू मेक इट फंक्शन प्रॉपरली. सो फंक्शन करने के लिए अच्छी लाइफस्टाइल होना, स्ट्रेस फ्री लाइफ. अब स्ट्रेस निकाल देना इज नॉट वेरी इजी, बट you need to be very cautious. What are you doing? Where are you putting your energy is into? So जब हमारे पास कोई patient आता है, when they walk into our clinics, they already have taken lot of medicines. बहुत सालों के बाद, बहुत महीनों के बाद आते हैं. Plus they have lot of online knowledge. It's a kind of advantage and disadvantage at the same time. कभी कभी बहुत आसान हो जाता है बताना कि हाँ आपको तो पता ही है कि ये चीज होगी, बट कहीं कहीं बार बहुत मुश्किल होता है, बिकॉज पेशेंट्स अपना प्रिस्क्रिप्शन बना के आते हैं कि दिस इज व्हाट आई एम हैविंग, दिस इज व्हाट आई एम एक्सपेक्टिंग फ्रॉम यू. देयर इट इज वेरी चैलेंजिंग. बट अगेन, as Dr. Renu told, I tell patients that please, you need to listen if you want to come out of this problem. So this is the state where patients are coming to us. Now, where are we lacking? Here, I want to tell that you have symptoms, all kinds of symptoms. It is not related with only female reproductive organs. Like in PCOD, you have hair fall, you have acne, you have extra hair growth, you have weight gain, you have mood swings, you have everything almost, because these hormones are so crucial. They act and they show that effect all over the body. But what we do is we treat the hair fall externally. We treat the extra hair growth externally. We try and do everything possible to remove the symptom. So जब symptom को mind में रख के treat किया जाता है, तो वो कहीं नहीं जाता है. Like for example, आपको कोई deficiency है. If you have some tingling sensation in your hand and you're taking some some B complex. 2 महीने के लिए खाएंगे आप, फिर से वो आ जाएगा, फिर 2-3 महीने बाद फिर से आपका टिंगलिंग शुरू होगा, नमनेस शुरू होगा, then again you will take supplement. But what is more important is to find out what is the cause behind this symptom. So symptom को mind में रख के अगर आप treat करोगे तो that is not going to go. What we do in homeopathy is removing and finding out the cause why these things are happening. Secondly, the holistic approach. Now holistic की बात आती है तो mostly everyone knows that it is more of lifestyle related, जहाँ पे diet होता है, नींद होती है, workouts होता है, कितना active lifestyle जीते हैं हम. But at the same time, it is very important to have a good emotional well-being. यहाँ पे बचपन से ही like हमारे पास अभी तो social media exposure is too much. So there are everywhere the parenting knowledge is going on, everywhere the inspiration, motivational videos are going on. So कहीं ना कहीं आपकी upbringing में वहाँ उसका असर होता है. Plus आपका जैसा family में environment है, तब भी ये बहुत important करता है कि आप कौन सी situation में कैसा react करते हैं. So why in homeopathy it is really important? Because every person, every patient will have different kind of medicine. अगर मेरे clinic में 10 patient आते हैं PCOD के, I'll make sure I'm treating that person and not the diagnosis or not the symptoms. So that is where in homeopathy it is very important for us to understand the patient as a person, as a constitution. Now, what a homeopath needs from patient. So we need a patient's symptom, first of all, like what patients are suffering from. Irregular periods हो रहे हैं, या फिर extra hair fall हो रहा है, extra hair growth हो रहा है. But सिर्फ यही important नहीं है. We really want to know how they are starting, the sequence of all the symptoms which you are suffering from. कहाँ पे क्या connected है? अगर आपको ज़्यादा flow हो रहा है, bleeding बहुत ज़्यादा heavy है, तो bleeding का blood का color क्या है? Clots आ रहे हैं कि blood बहुत thin है. This makes a lot of difference. I'd like to tell you that in homeopathy छोटी-छोटी चीजें भी बहुत ज़्यादा matter करती है, क्योंकि वहीं पे patient का constitution depend करता है. बहुत सारे लोग होते हैं जो ठंडी में भी बहुत गर्मी महसूस करते हैं. बहुत सारे लोगों को गर्मी में जो स्वेट आता है उसकी अलग अलग तरह की स्मेल आती है. ये सारी चीजें I can't tell you, I can't emphasize on this that these are very very important in homeopathy. और इसी में जैसे ये जो कॉन्स्टिट्यूशनली ट्रीट हम लोग कैलकुलेट करके जो मेडिसिन देते हैं, वहां जाके वो होलिस्टिकली आपका जो भी प्रॉब्लम है वो सॉल्व करता है. So coming to this, the symptoms, the exact history, the sequence, how the symptoms are surfacing on the body, the reports में आपका हार्मोन टेस्ट होता है, आपका स्कैन्स होता है. तो हार्मोन लेवल्स आर वेरी इंपॉर्टेंट, जहाँ पे एंड्रोजेंस, जहाँ पे फीमेल हार्मोन्स को चेक किया जाता है. तो these two things are very important. And patient as her true self. पेशेंट एज अ ट्रू सेल्फ मतलब हम लोग जहाँ पे ये भी जानने की कोशिश करते हैं कि आप कैसे है, आपका जब आप स्ट्रेस महसूस करते हैं तो आपका रिएक्शन कैसा होता है. हाउ डू यू डील विथ योर स्ट्रेसेस, व्हाट डू यू लाइक टू डू, व्हाट आर द एक्टिविटीज यू आर इंडल्जिंग, व्हाट आर द एक्टिविटीज यू जस्ट डोंट लाइक. कोई डर है क्या आपको. तो ये सारी चीजें हमें हेल्प करती है टू फाइंड आउट दैट एग्जैक्ट simillimum, जिसको हम बोलते हैं, because homeopathy is based on one motto, similia similibus curantur, like cures like. तो जब likeable जो similar medicine होती है, जो हम लोग पूरे symptoms के बाद जब हिस्ट्री के बाद हम लोग फाइंड आउट करते हैं, तो एग्जैक्ट मेडिसिन जब वो देते हैं हम लोग, नॉट ओनली फीमेल के रिलेटेड सारे सिम्टम्स क्लियर हो जाते हैं, बट अपार्ट फ्रॉम दैट इफ पेशेंट्स आर सफरिंग फ्रॉम सम अदर प्रॉब्लम ऑल्सो, they start feeling that they are getting better. If you're having some sinus problem, if you're having migraine, long standing migraine, if you're having some ear infection, you will start seeing that you are getting better in all those aspects. You start feeling better. If you're having constipation, you start feeling better in that also. Maybe it is not connected with PCOD, but because exact similar is given, exact similar medicine is being administered by thorough case taking of an homeopath, you start feeling that betterment in your life. The generalities get better. Now, how homeopathy works differently. अब होम्योपैथी में सिम्टम्स आपके ग्रेजुअली दे विल स्टार्ट कमिंग डाउन. यहाँ पे कीवर्ड है ग्रेजुअली, क्योंकि बहुत लोग एक्सपेक्ट करते हैं दैट द मोमेंट दे स्टार्ट टेकिंग मेडिसिन आई विल स्टार्ट फीलिंग बेटर, नाउ नेक्स्ट डे से आई एम गोइंग टू बी हेल्दी. अब यू कैन इमेजिन नाउ पेशेंट्स आर कमिंग विथ क्रॉनिक प्रॉब्लम्स, जहाँ पे सारी ट्रीटमेंट ऑप्शंस वो लोग हर जगह जाके आते हैं, दे हैव इनफ नॉलेज, and from years of suffering they come to homeopaths, and then they ask, ma'am, how long, like in how many days I'll start feeling better? So I tell them it is going to be gradual, so don't expect, it is not a magic pill, it will be gradual. And jo bhi cheeze gradual hoti hai, I'd like to tell you, they will be like long standing, they will be there with your forever in your life. Okay. सेकेंडली होलिस्टिक, जहाँ पे हमने बात की लाइफस्टाइल की, डाइट, वर्कआउट, स्लीप एंड इमोशनल वेलबींग की. प्लस वी ऑल्सो स्पोक अबाउट फीमेल हेल्थ के. अपार्ट फ्रॉम दैट यू विल स्टार्ट फीलिंग बेटर इन अदर सिस्टम्स ऑल्सो, like I said, for sinuses, if you have any dry skin issues, if you have skin problems, you'll start seeing changes in that problem also. Now, आप imagine कर सकते हो, like if you have thorough case taking, like for 1 hour with a patient, you will start understanding patient completely. You will start having connect. So that is where the counseling comes hand in hand when you are going to a homeopathic physician. This is how we are different from the allopathic approach. Now, these are few testimonials which I would like to share. These are some I keep getting such messages, but these two are very special for me, where a patient is saying that I was not willing to start homeopathy, but now I promise that I will not stop. And there's one more where patients started getting regular periods with very few doses of medicine, which is very close to my heart, these two. So I hope I wanted to make it very crisp and very short. I hope I could express how homeopathy works. Actually, it is a very in-depth science, but still, because we have a very short time, I wanted to make it a very short, sweet, and crisp. So if you want to ask anything, not here, but otherwise also, you can connect me here on my email ID and contact number. And finally, thank you so much for this opportunity. I am very grateful for this, giving me a stage to express my views on this topic. Thank you so much. If there are any queries, you can ask away.
Thank you so much, Dr. Priyanka. We have some queries in the chat box. One of the patient wanted to know that हम जो होम्योपैथी का ट्रीटमेंट अगर स्टार्ट करते हैं, as if you have explained it very well, कि इसमें we have to be wait and the treatment would be gradual, है ना. तो कुछ क्वेश्चन ऐसे ही आया उनका कि वो यही पूछना चाह रही थी कि होम्योपैथी का ट्रीटमेंट अगर बीसीओडी के लिए लेते हैं तो वो कब तक हमें लेना होगा और कितना लंबा चलता है.
करेक्ट, आई अंडरस्टैंड. सो होम्योपैथी जब भी आप लेते हो तो हम लोग वेरी माइल्ड डोसेज से शुरू करते हैं, एंड देन जो मतलब कैसा होता है ना, 2 प्रकार की चीजें होती है. अगर स्टार्टिंग में पेशेंट आता है तो मेडिसिन का स्ट्रेंथ वेरी करता है, एंड काफी टाइम के बाद पेशेंट आता है तो मेडिसिन का स्ट्रेंथ वेरी करता है. सो आपको अगर आपके जो सिम्टम्स के साथ आप आते हैं पीसीओडी के, उसमें अगर नहीं फर्क पड़ा है तो आपको जनरलिटीज में भी फर्क पड़ना शुरू होता है. यू विल स्टार्ट फीलिंग बेटर, यू स्टार्ट फीलिंग कामर, you start feeling that your bowels are getting clear, you start feeling good, not only for hair fall, PCOD के सारे symptoms, but generally you start feeling better. और जैसे जैसे आप कंटिन्यू करते हैं, आपको पीरियड्स रेगुलर आना शुरू हो जाते हैं, then eventually you will not need medicine, क्योंकि naturally हार्मोन आपके काम करते हैं. You start getting regular periods, your health is going to be better any which ways.
Thank you, Dr. Priyanka. One more query is there. Patient ये जानना चाह रहे हैं कि अगर हमें एक्सरसाइज फॉलो करनी है पीसीओडी के लिए, तो कितने टाइम हमें ये पीसीओडी एक्सरसाइजेस अपने लाइफस्टाइल में रखना है और क्या स्पेसिफिकली एक्सरसाइजेस हमें करनी है?
Is this for me or ma'am?
Dr. Renu.
थैंक यू डॉक्टर श्वेता. एक्चुअली देखो, मैंने जैसे आपको कई अपने टॉक में भी बताया कि एक फिजियोथेरेपिस्ट के पास बहुत सारे टूल्स अवेलेबल हैं, और वो आपके प्रोफाइल के हिसाब से that therapist will design the PCOD protocol. I showed also some research work which has been done, जिन्होंने कुछ specific protocols पे काम किया है, but it would be not right to say that that is the only protocol. So एक कोई single tailored protocol, I mean single protocol for all patients is not there. It has to be designed for each patient. मान लो आपको हाई बीपी है, दूसरे पेशेंट को नहीं है, तो फिर आपकी प्रोटोकॉल बिल्कुल फर्क होगी, दूसरे की होगी अलग. किसी का ब्लड शुगर लेवल्स का इशू है, डायबिटीज ऑलरेडी सेट इन हो चुकी है, तो उसकी प्रोटोकॉल बिल्कुल डिफरेंट होगी, योगासन्स भी फर्क होंगे. तो वी हैव टू डिजाइन इट अकॉर्डिंग टू द पेशेंट. कोई फिक्स प्रोटोकॉल बिल्कुल भी नहीं है. एंड आई वुड नॉट एडवाइज यू ऑल्सो कि नेट से, जैसा कि बताया उन्होंने, कि नेट से आप देख के अगर आप सोचोगे कि मैं
थैंक यू डॉक्टर रेनू.
तो इट वुड नॉट बी राइट.
यस मैम, यस, वेरी ट्रू. जैसे कि मैम ने बताया कि जिस किसी को भी पीसीओडी की शिकायत है, वो सबसे पहले अपने आप को एग्जामिन कराए. सिम्टम्स के अकॉर्डिंग ही हम एक मतलब सब्जेक्टिव प्रोटोकॉल या कस्टमाइज प्रोटोकॉल बनाया जाता है, और पेशेंट उसके अकॉर्डिंग ही एक्सरसाइज करे तो ज्यादा. बार बार यही इसी पे हम फोकस करना चाह रहे हैं कि अपने आप से एक्सरसाइजेस नहीं करनी, अपने आप से ट्रीटमेंट या थेरेपीज नहीं लेनी है. आप जाके पहले अपनी समस्या को बताएं, जैसे कि आप अपनी परेशानी या जो भी सिम्टम्स आपको आ रहे हैं आप उनको बताएंगे, उसके अकॉर्डिंग ही आपको ट्रीटमेंट प्रोटोकॉल बना के दिया जाएगा और उसी को ही फॉलो करें. अगला सवाल है. हेलो.
Yeah, Dr. Shweta, there is one more question in the chat box itself.
हाँ, वन मोर क्वेश्चन. दिस इज फॉर डॉक्टर प्रियंका. ये पूछना चाह रही हैं कि क्या होम्योपैथी ट्रीटमेंट से जो पीसीओडी में वेट लॉस होता है उसको भी ट्रीट किया जा सकता है?
डेफिनेटली, बट वेट लॉस सिर्फ मेडिसिन से नहीं होगा, क्योंकि पीसीओडी को ट्रीट करना इज अ टीम वर्क. इट्स अ टीम वर्क ऑफ यू, लाइक आपको उसमें बहुत ज्यादा देना है, डाइट फॉलो करना है, एक्सरसाइज फॉलो करना है. सो विथ मेडिसिन ओनली वेट लॉस का बाई प्रोडक्ट नहीं होता, इट विल बी द लाइफस्टाइल चेंज. सो इट कम्स हैंड इन हैंड.
One more question is there by Dr. Shikha. She wanted to know about the trigger point we were talking about during the pelvic examination. This is for Dr. Renu.
Yeah. See, when I was practicing, I was working with a gynecologist, and I am linked to the gynecology department, and I had learned the examination from them, and I have been practicing. I have been doing invasive physiotherapy on these patients, and only a person, but these days, there are certificates. You have to have a certification to do invasive physiotherapy in women's health. So you would have to first take a few courses on this and then go about it, because nowadays everybody is not allowed, and especially a general physiotherapist would not be able to even understand or palpate a trigger point while doing the pelvic floor examination. So it cannot definitely not be told online.
Very true. Certain techniques we have to get mastered, and that can be done practically also, not on the webinars. And another question we had from Ritika. She had symptoms of PCOD, but her examination result were normal for both the scans and the hormonal levels. Like she was saying that scan and the hormone levels are normal, but she was asking, is there any another reason for hyperpigmentation or any other method to manage that thing? Dr. Priyanka?
हाइपरपिगमेंटेशन इज ऑल्सो वन ऑफ द साइन कि आपके हार्मोनल इम्बैलेंस है. जरूरी नहीं है कि आपका रिजल्ट आना ही चाहिए, मे बी थोड़ा माइल्ड रहेगा, बट मतलब नॉर्मल लेवल में ही रहेगा, इतना ज्यादा हे वायर नहीं हुआ है. सो यू आर इन अ मच सेफर जोन. अगर आपके पीरियड्स नॉर्मल आ रहे हैं, सो यू शुड फोकस ऑन अदर थिंग्स, लाइक मे बी कुछ स्ट्रेस रहेगा. सो जैसे मैंने कहा कि कॉज मालूम होना बहुत जरूरी है. सिम्टम्स कहाँ पे शुरू हुए हैं, कब एग्रेवेट हो रहे हैं, ये जानना बहुत जरूरी है. सो दैट इज द मेन की फैक्टर.
One more question we have. पेशेंट सफर कर रही हैं इरेगुलर पीरियड से और कंटिन्यूसली ब्लीडिंग है उनको 2011 से 17 के बीच में. फॉर दिस शी हैड डन यूट्रस रिमूवल उन्होंने करवाया है अपना. नाउ शी इज आस्किंग कि क्या स्टिल उनको पीसीओडी की पेशेंट, मतलब वो जानना चाह रही कि क्या वो अभी भी पीसीओडी की मरीज हैं, कि उन्होंने यूट्रस रिमूव करा लिया और उनकी सिम्टम्स क्लीन हो गए, ठीक हो गए हैं.
नहीं, बट यूट्रस निकलने के बाद अभी क्या है तकलीफ, लाइक प्रेजेंटली व्हाट शी इज सफरिंग फ्रॉम अभी, लाइक 2011 और 17 में हुआ ना.
हाँ हाँ.
बट राइट नाउ व्हाट शी इज हैविंग प्रेजेंटली.
हाँ, प्रेजेंटली उन्होंने ऐसा कुछ लिखा
No,
नहीं है.
I can I just
Yes ma'am, yes ma'am.
Yeah, actually, see, she has had her hysterectomy done, but the ovaries are still there, you know. So she is a PCOD patient even after the removal of the uterus. She will continue to be a PCOD patient, right? Till you know, the normal, I mean, till she grows older, say around 45ish, जब हमारा generally menopause आता है, that time, you know, she will, I mean, you can say that now it is over, or she's, you know, on the waning, but she is a PCOD patient.
ओके मैम. डॉक्टर प्रियंका, जिस मरीज ने पूछा था कि उनके हार्मोन्स और स्कैन के लेवल्स नॉर्मल हैं, तो जो हाइपर पिगमेंटेशन की शिकायत उनको हो रही है उसके लिए वो क्या क्या उसका रीजन हो सकता है, मैनेज कैसे करना है, एक बार आप प्लीज दोबारा से उनको एक्सप्लेन करें. वो हिंदी में एक्सप्लेनेशन चाह रही है.
हिंदी में चाह रहे हैं?
Could you explain in English में चाह रहे हैं? इंग्लिश में चाह रहे हैं.
Okay, okay. So hyperpigmentation is also one of the sign of hormonal imbalance. Okay, so it's not compulsory that the hormones which shown in the report are like, there will be, I think there is only a mild variation, but hyperpigmentation could be because of some other cause. So we need to find out what could be that cause. So when that started, if it is aggravating, what are the reasons it is getting aggravated? So if you can connect one-on-one, that would be fine, so that we can find out the exact cause and treat it accordingly.
हमने डॉक्टर प्रियंका का नंबर शेयर किया है. अगर आपको कोई भी परेशानी होगी तो आप मैम से कांटेक्ट भी कर सकते हैं. एक बार डॉक्टर प्रियंका आप अपना कांटेक्ट और अपना लिंक एक बार फिर से शेयर कर दीजिए, सो दैट एवरीबॉडी कैन नोट डाउन.
Can we write down in the chat box, right? Dr. Shweta, that was the last question or anything else?
लास्ट क्वेश्चन है, डाइट के बारे में पूछा गया कि किस तरह की डाइट को हमें फॉलो करना चाहिए.
Dr. Renu, I think she'll guide better in that way. Renu ma'am.
Renu ma'am.
Renu ma'am.
That's okay. Yeah. Hello. Yes. Yeah. Yeah. Can you hear me?
Yes ma'am, एक क्वेरी है, जानना चाह रहे हैं कि किस तरह की डाइट को हम पीसीओडी में फॉलो करना है.
अच्छा, ओके. See, as I said, हम जब कोई भी डाइट प्लान या एक्सरसाइज प्लान बनाते हैं तो उसमें बेसिकली, आई मीन, एज फार एज डाइट इज कंसर्न, ऑप्टिमम फूड, जैसे जो आपके जहाँ पे भी आप रहते हो, मान लो सदर्न इंडिया में रहते हैं या ईस्टर्न इंडिया या नॉर्दर्न इंडिया, तो जहाँ जो उस प्लेस का नेटिव फूड है, जो आप खाना बचपन से खाती हैं, जो नॉर्मल है वही आप खाएं, कीपिंग इन माइंड कि आप का वजन बढ़ाने वाला खाना बस ना हो, जैसे उसमें एक्सेसिव फैट्स ना हो, या कार्ब्स और प्रोटीन्स का बैलेंस ठीक होना चाहिए. कुछ लोग कहते हैं कि हाई प्रोटीन डाइट लो, लेस कार्ब्स लो, बट what I have discussed with various nutritionists and the dietitians at our hospital also, they stress on a balanced diet basically, and homemade food, no packaging, no packet food with a label, you know, वो नहीं. बस यही एक standard I think instruction होता है. Otherwise, I don't think there is anything else. बाकी तो specific, as I've said, patient specific. आपको BP है तो आपको उसके हिसाब से diet बताएंगे. कुछ diabetic हैं तो necessary precautions you have to take. I hope that answers the question. इसमें कुछ भी इसका इस पूरे syndrome में you cannot आप कोई generalized protocol अगर हमसे पूछेंगे तो we cannot say कि भाई यही exercise करना है, यही diet खाना है तो उससे सब ठीक. No, it is very individual. I hope I answered your question.
I would like to add it on. कुछ chemicals है which trigger these PCOD symptoms. Like अगर if we talk about the BPA जो plastics में पाया जाता है, तो अगर कुछ plastics में अगर BPA higher उसमें है तो that can also trigger the symptoms of PCOD, or that can also increase these PCOD chances. तो अगर हम लोग ऐसे packaged food और जो हम लोग प्लास्टिक में गरम करते हैं खाना, या हम अवन में गरम करते हैं प्लास्टिक्स में डाल के, that is also
unable to hear you, Dr. Vidu. I'm unable to hear you.
Am I audible?
I'm unable to hear you.
I'm not audible right now.
Yes,
Dr.
you
Shweta,
are.
You are audible, Dr. Vidu.
Yeah, actually I was talking about the BPA itself. BPA जो कुछ प्लास्टिक्स में पाया जाता है, हम लोग जैसे खाना गरम करते हैं, माइक्रोवेव ovens में हम लोग खाना गरम करते हैं, so if the toxins get released into the food, that is also creating these PCOD problems. वो भी trigger points है. So we need to take care of that as well कि प्लास्टिक्स में फूड हम ज्यादा से ज्यादा पैक ना करें, और उसको हम कम से कम क्वांटिटी में रिलीज, मतलब बेसिकली टॉक्सिन्स को रिलीज ना होने दें. So that is also the one of the reason. Is there any other question, Dr. Shweta?
No, Dr. Vidu. All questions are answered.
Okay. So I think it was very nice session with you, both Dr. Renu and Dr. Priyanka. It was very well said, और बहुत अच्छे से it was very well explained by you both. और I hope कि जितनी भी कुछ भी queries है, we were really able to explain it well. जितना भी हम लोग समझा सकते थे, हमारी like it was a truly our best of the knowledge के जितना हम लोग अच्छे से समझा सकते थे, जितना हम लोग कर सकते थे, we give our best. So I think thank you so much. Thanks Dr. Renu and Dr. Priyanka once again. And our sincere gratitude to our president, Dr. Sanjeev Jha sir, Dr. Ruchi Vashnan, Dr. Pooja Sethi, Dr. Deepti Goyal, Dr. Nidhi Kalra for their able guidance, support and continuous encouragement in all our efforts. And thank you our technical team for providing such a online platform where we are able to connect with each other during this pandemic time. And thanks to all the participants who gave us their valuable time and listened us patiently. So and at the end, last, wish you all a very happy Holi. So tomorrow is a Holi festival. So please, you enjoy a lot. Happy Holi to you all, ma'am.
Happy Holi.
Thank you,
everyone.
Happy Holi, everyone. Yeah, thank you.
Happy Holi to all.
Thank you. Thank you for being
Thank you. Thank you so much.
Thank you for being with us.
Thank you.
Thank you so much, ma'am.
Thank you.
Thank
Thank
you.
you.